Welcome to today's COVID-19 update. We're speaking with the Honorable Minister of Health, Dr. Frank Anthony. Minister, welcome. So let's start off with Monday and us receiving the Sputnik V over 67,000. First of all, your general thoughts on that, and of course this comes from the first set of 200,000 that was ordered.
Yeah, well, we continue to get in Sputnik vaccines because, as I've said before, this is one of the ways that we are going to quickly immunize our population. So yesterday we received 68,000 doses, 40-something thousand of the first dose, and the rest being the second dose. So with these doses, we've already started the distribution of them across to the different regions. And by today, many of the vaccination sites would have additional doses of Sputnik first dose to give to persons who need them.
All right. As we're on the same topic of vaccine, I know you indicated yesterday that we're expecting more vaccines, and this would be another 600, of course, the 200 excluded from that. I just wanted to ask you to give us a little bit more of information.
Well, we are looking at acquiring 800,000 doses of the Sputnik V. Already we have sorted out 200,000, and we have put arrangements in place for the other 600,000. So with 800,000 doses, we'll be able to immunize 400,000 persons, because as you know, this is a two-dose vaccine, first dose, second dose, and that's what we are working on.
Right.
Not all the vaccines would come in at the same time, they will come in tranches. And as fast as we get them, we will be distributing them and making sure that people can have access to these vaccines.
And the set that came in yesterday, I know that last week you had mentioned that persons are it's getting closer to their time to return for the second dose, and you were encouraging them to check their cards and so on. So some of those second doses, as you just mentioned, comes from that set as well.
Yes, what we have is that the Sputnik V, there's a shorter time interval between first and second dose. So we are working with a 28 days interval, and therefore it's important for persons who have received their first dose to check their cards to ensure they know the date of the second dose and come to one of the centers to get their second dose. Now, you would know over the period we have had a lot of outreaches in different communities. And don't wait until we come back to your community. If there's a neighboring site where they're doing vaccinations, come to it so that you can get your second dose. So we don't want people to delay too long to get their second dose. So once that date is coming close, you can come either a little bit before, a little bit after. That's okay as well. Some people have asked me, well, you know, I can't make it on the exact date that is on the card. Well, you can come immediately after if you had some issues on that particular date, or come a little bit before if you can do that. So what we don't want is for people to miss their doses completely. So we are encouraging all those persons who have received their first dose to ensure they come back for their second dose. Because unless you get both doses, you're not going to be fully immunized. And that's important, right? So we have noticed that people who are fully immunized, they do much better. We have not seen cases of infection with people who have been fully immunized. We have not seen people getting hospitalized, nor have we had anyone dying once they're fully immunized.
It's on that note that you end there, I wanted to follow up by asking, we're on to the second dose as well for the AstraZeneca vaccine. And while we have seen far and apart international stories, cases, and so we have not had that recorded here. And I wanted you to talk just a little bit again on the efficacy of this particular vaccine.
So AstraZeneca is also a very good vaccine. And as you know, that's the first vaccine that we've started using here in Guyana. It is approved by the World Health Organization, and they have gone through all the safety checks to ensure that the vaccine meet those safety safeguards. And so we have been using that. We have received AstraZeneca vaccine from a number of partners, India, Barbados. We have also received it through COVAX, and COVAX has had a vetting mechanism. Now, indeed, there is an issue that was discovered where in some rare cases, extremely rare cases, one of the adverse events of the AstraZeneca vaccine is associated with some form of clotting. But those are extremely rare events. It's not, everybody that received this vaccine would get a clotting event. This is probably 1 in a million person or more. So it's an extremely rare event, and it happens under certain conditions with certain persons and so forth. And we have taken those things in consideration, and when we are issuing the vaccines, we make sure that we ask whether persons have allergies, whether they have a history of clotting, and so forth. And if we discover any such person, then we advise them accordingly. So because we're screening, the chances of anyone who take the AstraZeneca vaccine would have an adverse event is even more reduced. And globally, while there have been cases of some clotting, again, these are very few cases. Now, in the rollout of this vaccine, there have been countries who were very concerned about clotting events, and they stopped the rollout or paused the rollout. They investigated the reasons why, and then they concluded that because it's such a rare event, that the benefits of having the vaccine far outweigh the risk of not getting the vaccine. And so many of those countries that had paused the rollout of AstraZeneca are now using back AstraZeneca. And so the vaccine is widely used. Literally millions and millions of people around the globe would have received this vaccine, and they're doing okay. So that's something that one of the vaccines that we use here is AstraZeneca, and we have not had any recorded adverse side effects with AstraZeneca.
If I could ask you to just reiterate for me just a little bit, persons who decide on their own not to come back and get a their second vaccine, where does that place them?
Well, then you would not be fully immunized. These vaccines, they work because with the booster dose, which is the second dose, that is what would take their levels of immunity up. So you get more antibodies in your system, and the duration of that immune response would be more sustained. If you just get one dose, yes, it would stimulate your immune system, but that response is not going to be durable, and it's not going to be as effective as if you get both doses.
Okay, thank you, Minister. Could I ask you for an update on our vaccination figures to date?
Well, as of yesterday, I think we have done the team across the country have really done a good job. We've had our highest numbers yesterday. So for first dose now, we are at 169,981 first dose was administered, which accounts for 34.9% of our adult population. With second dose, we are now at 34,317, which accounts for 7% of our adult population. So that's really a good number because more people now are fully immunized. And if we look at it as the percentage of persons who received their first dose and now took their second dose, that would be 20.1%. of those who received their first dose now taking their second dose. So I think over the last 24 hours, we would have seen a good pickup in terms of people coming out to get their second doses and first dose. So yesterday we did close to 7,000 immunizations. And we'd like that number to go up even higher today.
Of course, yes. I have some questions from newsroom. The first one, they're asking, could Minister Anthony comment on a statement made by PAHO advisor Dr. Jairo Mendez Rico indicating that the P1 variant is in Guyana?
Well, as I've said before, we don't know what are the different types of variants, if there are any, that is circulating in Guyana, because from the limited amount of gene sequencing that was done on 10 samples, we were not able to identify any such variant like P1 or any one of the others. So this is really news to us. I have since asked PAHO for a report pertaining to this disclosure, and we are awaiting their PAHO's response.
Okay, thank you. I know earlier on we had spoken about samples and so being taken, and we had already discussed it, but they're asking today if there were any further variants, specifically from samples from Region 9, if those were taken. I think they meant to say samples and not variants. But.
Yeah, but again, I have explained this before, because getting genetic sequencing is not an easy process. And we continue to try to work with agencies that can get this done for us. But so far, we have not succeeded in getting samples to these agencies.
All right. My final question to you today, I know you're back from commissioning the maternity home in Region 9, and that's a project that you've been working on for a little while. Could you tell us a little bit about this facility finally being able to be used basically by residents in Region 9?
Well, this is one of several projects that we are doing in Region 9. This waiting home, as you know, because of the geographic location of Region 9 with those 57 villages, sometimes it's hard if a mother is ready to give birth, to get an ambulance to pick her up and bring her to the hospital. It can be quite challenging. So what we have decided is to build a waiting home in the compound of the hospital, so those expectant mothers can come there, wait, and when they're ready to deliver, they'll be able to have institutional delivery, which would be much safer than if you're delivering at home. So the facility that we just opened, it has 14 beds, 7 prenatal and 7 postnatal. And hopefully that would help to reduce maternal deaths in the region and infant mortality in the region as well. So that was the aim why we put that together. In Region 9 as well, we have some other projects that are ongoing. There are 4 health centers that we'll be upgrading, and those health centers, by the end of the year, they should have a full upgrade. We are also working on the district hospital at Aishalton, and by the end of the year, we would be able to put in a theater at the Aishalton Hospital, and we are going to be adding an X-ray unit in that Aishalton Hospital as well, so that the range of services that we are offering at Aishalton would improve considerably. Late last year, we have also given to Karasabai a new ambulance, and that is to facilitate the transport of patients from Karasabai to the Lethem Hospital. The ambulance is also equipped with incubators, so if we need to transport an infant, that can be done safely as well. So there are a number of projects in Region 9 that we are currently working on. And when we finish those projects, we're going to see a tremendous improvement in the infrastructure of the health infrastructure in Region 9. At the Lethem Hospital itself, we have a combination of projects that we're working on. So we're going to extend a section of the hospital to develop an ophthalmology department so that anyone in the region who got problems with their eyes or eye diseases would be able to access that type of service. We are currently, through the Smart Hospital initiative, doing some improvement on the Lethem Hospital. This includes fixing the accident and emergency, the outpatients department. We have already finished the area with the pharmacy, and we are going to be adding a new theater space with ICU and recovery areas. So there would be a lot of improvement in the hospital in the next coming months. In addition to that, we are also making the hospital more resilient, meaning that they'll be using a lot more solar power, and we'll be capturing rainwater and repurpose that for use within the hospital itself. Yesterday as well, we opened the vaccination site. We have a vaccination storage site in the compound there as well, where we'll be able to store vaccines. There's a new building that was built specially for that, and it has its own power source, so just in case there's power failure, that we have a generator to back that up. The ministry has also sent in a number of refrigerators to complement what they already have, so that we can have some storage of vaccines there as well.
Okay. All right. Minister, thank you so much for speaking with us.
Good.
Well, that's it for today's COVID-19 update. Of course, we just spoke with the Honourable Minister of Health, Dr. Frank Anthony. Remember, for more information, you can log on to our website, dpi.gov.gy, and the Ministry of Health's website as well, health.gov.gy, and of course, our social media platforms.